Those of you who've been regular watchers will not be new to her, and she's going to spread the word and try and encourage us to take the smear test seriously. So welcome, Doctor.
Thank you.
And again, I've got a young person, Shanice, who's here, and she's also going to share experiences with us in relation to the smear test and, try and attract the young viewers. Let them know how important it is to take it seriously. So, cervical cancer, what's that?
Well, that's a good question, and thanks for having me again. So cervical cancer, we talked about cancer before. So cancer is a mutation of cells, normal growth of cells. So this time, it's happening in the cervix. And the cervix is the neck of the womb. So the womb is like a pear. You know the conference pear? Next time you see a pear, just think of your womb. So it's upside down.
Yes.
I wish I got a pear with it. So basically you have the womb and then the neck, because the way the pear narrows down, that bulbous bit at the end, that's exactly what the shape of the womb is like, and that opening is the cervix, is where the baby comes through. So it's the opening to the womb, and you can have changes there which could be cancerous. Cervical cancer is cancer affecting the neck of the womb.
Okay, in a nutshell. All right, and the way to detect it is the regular smear test, which we all know about.
Yes. So basically, cervical cancer, sometimes people don't always have symptoms. Where there are symptoms, the symptoms will have to do with activity that goes on in that area. What activity goes on there is sexual intercourse. So if people have bleeding after sex, they're meant to come and see us and tell us about that. Or if they have an unusual vaginal bleedings, obviously the women would expect a period every month if you're not on a Mirena coil, for example. And if you had a regular cycle and you now had an extra bleed in between when you were not expecting one, then that could be a sign of cervical cancer. I'm not saying that it is, but that's one of the ways in which we pick it up. And so when you present to someone like myself or my colleagues, what we will do will be examining the neck of the womb. We'll be using an instrument called a speculum to open it up, shining the lights in, having a close look, and then looking at the cells. And then what we do, because when we look at it, sometimes you can see something that's really obvious.
Okay.
But most things, especially when it's early, it's not that obvious. And so we take the sampling from the neck of the womb, and we send that off to the laboratory to be processed. And that process is the cervical smear. I must emphasize, because sometimes I get some women who are from Europe, and there it's referred to as Papa Nicolau. Another is their pap smear. So these are different words for the same thing. And also, I need to differentiate that it's not the same as having a sexual health check. Because some women who've gone to the sexual health clinic, young people like your age group, Shanice, who've gone to the sexual health clinic and had a checkup there, they come back and say, oh, I've had a smear. They haven't had a smear. They've had a sexual health check for infection that could be on the cervix or could be in the vagina. Well, that is not the same as a smear. So a smear test is a very definite thing. You will know you're having it because it doesn't feel very nice.
And they do tell you, don't they? Right, but at what age? Because in the UK, you have a free smear test. At what age do you start?
So in the UK, we send out invitations to every woman who is living here from the age of 25. So from the age of 25 to 49, you get a reminder to come and have a smear test, and that's every 3 years. When you get to age 50 to 64, it's every 5 years. And at 65, you get an invitation if you've had an abnormal smear quite recently, so you're 50 to 64 bracket, or if you have never turned up. We keep on trying.
Yes.
We keep on trying.
Get
new wins. So that's sort of a timetable we follow.
Okay, so why do they give it to women of that age group and not earlier?
Well, that's a very good question, because I sometimes get that from my patients who turn up from Canada, for example. And I think the reason, when I was doing the research, the reason is up to the age of 25, even though those women are sexually active and at risk of cervical cancer per se, their age is protective because they have changes in the cervix that mimic that could be mistaken for a cancer, but it's not a cancer. And so it's too early to start checking at that age. However, if someone of that age presents to me with symptoms like I've mentioned earlier, so bleeding during intercourse, and gives me a sexual history where they've had a lot of intercourse with different partners especially, and had maybe some other infections, I might be more willing to try and get them a smear before 25. Well, the screening program, the national screening program, is from age 25.